Call the OnPoint board to order for the March 19th, 2024 meeting. All rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated. I'll be taking the roll at this time. Kimberly Bartnick,
Present.
Jessica Castaneda.
Here.
I got that correct, right?
Better every time.
Thank you. Glenn Brookhouse. Here. Mark DeYoung has an excused absence. He is in Florida. I am here. Jane Farrell.
Here.
Beth Johnson.
Here.
Alice Kelsey.
Here.
Robin Clay.
Here.
Dr. Robin Clay.
Oh, I insist. Robin is here.
Karen Stratton. Karen Stratton. Pastor Craig Van Beek. Here. We have a quorum. Next on the agenda is the provision for public comment. Is there anyone in the public that would like to avail themselves of this opportunity to address the board on any agenda topic or anything else? Second call. Hearing none. Is there anyone online, Megan?
Susan, would you like to make any comments?
No, I am all set. Thank you.
Okay. Yeah. With there seemingly no one that would like to take opportunity here at public comment, the next thing on the agenda is the approval of the agenda. Do I hear a motion to approve the agenda?
Yes.
Thank you, Robin. Do I have a support for that? Support by Jessica. Is there any discussion? Hearing none. All in favor of the agenda as moved? Say yes.
Yes.
All opposed? Motion is carried. Next on the agenda is the review and approval of the minutes for 2/20 of 24. Is there any additions, subtractions, or corrections?
Mr. Chairman, those were the closed session minutes, and so need to be distributed to those who were present for approval and then returned to Megan.
Yeah.
Okay, now do I have that in a pile here or not? Okay, would you distribute those?
Yes.
Thank you, ma'am. No. Is there any additions, corrections, or subtractions to those minutes that were just distributed for approval? Okay,
You got a question?
No.
No.
okay, I'll entertain a motion.
Move to approve?
Motion by Beth Johnson. Do I hear support? Support. Pam's got that. You gotta be a little quicker. All in favor of this, say yes.
Yes.
All opposed? Motion carries. Okay. And do you have all of them or? Thank you.
She's like a carrot.
Next on the agenda is the consent agenda. Is, there any, particular ones of that anyone would like to have removed from the consent agenda at this time? Seeing no hands. Entertain a motion to approve the consent agenda as presented.
Move to approve?
All right, which one?
I don't care. I started, but she started before.
No, you, and support? Do you want that? Jane has it. I'll take a roll call on this. Kimberly Bartlett,
Yes.
Pam Brenner,
Yes.
Glenn Brookhouse,
Yes.
Jessica Castaneda,
Yes.
Gail Dugan says yes. Jane Farrell,
Yes.
Beth Johnson,
Yes.
Alice Kelsey,
Yes.
Dr. Robin Clary,
Yes.
and Pastor Van Beek.
Yes.
That motion is carried. I will now have, introduce to you Alan Bolter from the Associate Director from the CMHA Association of Michigan. Alan, this is the OnPoint CMHA Board.
Well, good evening. Thanks for having me. Much closer drive than what I've had lately. I live over in nearby Kent County, so your neighbor to the north. So
Oh, yeah.
easy drive down for me today. So I sent over some information. So you have that. I'm not going to go through all of that, just so you have it. I'll just kind of give you a little bit of rundown of, what's going on in Lansing, kind of what we're working on through the CMH Association on your behalf and on behalf of our members across the state. And then happy to take any questions that you may have. But I guess I'll start on the budget side first. So start with the money first. So we are in kind of full appropriations process in Lansing right now. Governor Whitmer came out with her FY25 budget recommendations on February 7th. So now you have, the governor comes out with her recommendations, and now you have the House kind of working on their own set of recommendations based on the governor's budget. And you have the Senate working on their own set of recommendations based on the governor's budget. And you'll have, probably over the next several weeks or so, they'll continue to work on those. They'll end up ultimately voting out their own budgets, both the House and the Senate. Then you're gonna have at some point, this spring, early summer, House, Senate, Governor all come together and coalesce around one budget, pass that to the legislature, send it to the governor for her signature. So we're kind of in that process now. The budget, has been, very interesting so far. FY24 budget, so the current year that we're in, last year's budget that passed was the largest in the state of Michigan history, $87 billion. A significant portion of that was a lot of the one-time, billions of dollars the state of Michigan received from the federal government over the last several years from the COVID relief, infrastructure packages, you kind of name it. I mean, they had, roughly $9 billion in kind of, federal dollars that have come in. It's given the state tons of flexibility. They have now since spent all of that money. So the budget that the governor presented this year to the legislature was a little under $82 billion. So it was around 81 billion total. So less than last year, still a heck of a lot of money. Prior to COVID, I think the Michigan budget was, probably upper $60 billion. So, we're still far, far above that, but it is going to be a little bit more of a challenge this time versus what it has been with just kind of the free money all over the place, doling out dollars. So there will be a little bit more restraint as far as the budget process. I did include kind of past the PowerPoint. It is kind of a handful of slides there that kind of talk about what was included in the governor's budget recommendation for FY25. Last year's budget, this year's budget, the record amount of money that was spent, really the single largest item for behavioral health across the board has been the state's investment in CCBHCs, which obviously, this entity OnPoint is now one of our CCBHCs in the demonstration project. For the FY25 budget, that was $193 million. So the governor recommended to continue to further expand the CCBHC program. Still up in the air how many additional sites that will be. Is it going to be 10 or 13? Who knows? But they recommended $193 million in the budget. Last year, OnPoint was one of the new CCBHC sites that entered in the demonstration. I think the funding for last year's budget for the CCBHC expansion was around $287 million. So tremendous investment in the CCBHC program where, went from, starting out $100 million program to now almost a $600 million program. I mean, that's probably the single largest investment in behavioral health, probably since, the state ultimately flipped over to Medicaid managed care, where, Medicaid came in and started picking up the bulk of the programming costs across the state. Outside of that, I mean, it's kind of slim pickings as far as what investment was out there. So I don't want to, make it sound like, we're complaining about all the investment in CCBHC, but there's really not a whole lot of things to point to outside of that. For instance, in the governor's recommendation this year, there was a $36 million mental health rate increase for mild to moderate services, but that goes to the Medicaid health plans. There was $8.3 million for heart specialists on the SUD side, but that goes to hospitals. There's $4 million in there for gambling prevention. There is in the budget for this year, there's only a $14 million line item in there for direct care wage, and that's 85 cents for a group that didn't get the money last year. There is no additional direct care wage increase this year for those staff. Now, the 85 cents that was in the budget for FY24, the 235 that was in there for the previous year, that's still included in the overall Medicaid funds, but there is no additional funding beyond that. There is, one issue that we've had with the budget the last couple of years. There is again, $300 million in the budget for, mental health in schools, school safety, where that money goes directly to the school systems, allows them to hire staff, allows them to do other things. Again, we'd like to see more collaboration on that front versus giving that to the schools. One of the issues, if money goes directly to the school districts for them to hire staff, As the board is probably well aware, it's not like the staff grow on trees, and we tend to know where that staff comes from. It comes from our CMH boards and it comes from our providers. Another highlight I would like to point out in the budget, which I think is going to be important moving forward. We've been working with MAC, Michigan Association of Counties, and the Sheriff's Association. We reached out to the department last year, encouraged them to apply for 1115 waiver for, essentially to allow for Medicaid jail-based services. A number of other states have applied for 1115 waivers, have been granted them by the federal government that would allow for Medicaid to be used in local county jails 90 days prior to being released. Most of the folks in our local county jails are not there for 90 days. If they go into a jail right now, they're not able, Medicaid gets shut off. Essentially, that means a lot of the services they were receiving, they no longer receive. Or if they do, it's then the county's picking up the tab for that. So we're excited to see that. There was $30 million in the governor's budget for that. It's clear what exactly the $30 million covers, because the state still has to apply for the waiver, get the waiver. And then by the time the program gets up and running, we're still not sure what the cost of the overall program is going to be. But $30 million in there, my guess it's probably for partial year funding, assuming that we're going to get approval and moving forward with that. But we'll continue to advocate with counties, with the sheriffs, to make sure that stays in the budget. But what we're going to see over the next several weeks and, probably the next couple of months, like I said, this is kind of what the governor recommended. And, you're gonna have, the House is gonna come up with their own set of recommendations. The Senate will come up with their own set of recommendations. So I think one of the things that I sent over were some of our recommendations in the budget. And I think the single largest item that we have in the budget, I also included in the handouts, an infographic that talks about the Medicaid redetermination, or if you want to call it disenrollment, Medicaid rate structural issues that are going on. I think that's going to be by far the biggest issue and challenge that our membership is going to face, for current fiscal year, for next fiscal year, moving forward. Is going to be how that whole Medicaid issue kind of gets worked out. So as far as the budgeting process, one of the things I started talking to legislators probably a couple of weeks ago on this particular topic, were, during the COVID pandemic, as you know, the public health emergency did not allow the state to do redeterminations for people on Medicaid. During the public health emergency, Medicaid caseload ended up going over 3 million people for the first time ever. Prior to COVID, we were around 2.2 million people on Medicaid. As you're all well aware, more people on Medicaid means the more dollars coming into the system. Now the public health emergency is over. The state has now started that process of Medicaid redetermination. We've already seen some initial data on that as this process is going on. We believe that the disenrollment is deeper and steeper than what we thought and what the state has actually projected, which means there's going to be far more people dropping off of Medicaid much faster. That means much less revenue coming into our PHP systems, which means much less revenue for our CMH boards. So trying to raise some awareness of legislators of, one, how the system is funded. More people on Medicaid means more dollars. Less people on Medicaid means fewer dollars, which means you have to adjust Medicaid rates to make up for that loss of volume. The vast majority of people that are served through our CMH system are not the people that are coming on and coming off of Medicaid. I mean, they are 350,000 people that are on there for a very long period of time. So as people drop off Medicaid, our costs do not drop off.
Right.
The Medicaid rates over the last several years during the pandemic have not reflected the significant increase in staffing costs, provider costs, just the cost of doing business in general have gone up. Those rates have not reflected that. They need to do a better job of reflecting those costs. Also, what's going to be very important would be as people get redetermined, that they get put in the proper bucket. And I know before the board meeting, there was some discussion about where people are getting slotted as they get redetermined. That makes a huge difference. When the state of Michigan adopted the Healthy Medicaid expansion, Healthy Michigan, that was roughly 2014, 2015. We saw in 2016, 2017, about 40,000 people that ended up getting redetermined, ended up going from disabled, aged, and blind on Medicaid to Healthy Michigan during that redetermination process, because it's frankly just much easier to get redetermined. If you're qualified for Healthy Michigan, you basically show your W-2, they check your income, boom, you're in the program. The benefits are the exact same. It's far less paperwork for people. It's far easier for caseworkers to re-enroll them. When that happened, we had, over 40,000 people. The difference in reimbursement would be, we get almost $400 if someone is disabled, aged, and blind under Medicaid. We get like $40 if they're on Healthy Michigan. That was about $100 million difference in a financial hit to our overall system. So we had to prove to the department that that was happening. After bickering back and forth, we were able to get the legislature involved at that time. We ended up getting about $60 million back from the state. It ended up costing us about $100 million. We got about $60 million back. Again, that's our fear with, you're talking about the sheer volume of people that are getting redetermined this time. If we get tens of thousands of people that are slotted in the wrong bucket, plus we're losing hundreds of thousands of people on the front end, we don't have the reserves to withstand a long period of shortfall, a significant shortfall in revenue. Then we have some significant financial issues. So just trying to get this on the legislature, just to kind of put it in the forefront as we talk about redetermination as a whole, that they have some of this in context. So when the department or someone comes up and talks to them about it, they at least have this awareness out there of how this system is uniquely impacted compared to, it does not impact the health plans in the same fashion. Their reimbursement rates are not as extreme as ours, from Medicaid to Healthy Michigan to what have you. And when people drop off, their costs drop off, ours do not. So I think that, again, that's going to be one of the biggest issues that we talked to them about. And the tough part is we don't really have solid numbers. I mean, we do have kind of an idea now of FY24, and I think the FY24 number issue is slightly different than FY25. The issue that we have for fiscal year 24, the money that the legislature appropriated, that the governor signed off on, the department is not sending all that money out for fiscal year 24, because those numbers are based on high caseload. So if you think about it this way, we've got high caseload means a smaller amount per person that gets sent out. Lower caseload means a higher number that they're sending out. So 24's numbers are based on a much higher caseload, but a lower amount for reimbursement. So that's why we have to get them to adjust the reimbursement rate, because the caseload number is much lower than what they originally set it at, because people are dropping off. We think that there's probably,
Just to tell you that your chart, we put in the packet this
Okay.
month on page 12. So if you want to see the visual description of what Alan's talking about, it's right there.
exactly. So we think, so the bottom line is, we believe that the amount of money that the legislature appropriated for fiscal year 24 is enough. They just have to send all of that money out. So we don't think we're gonna have to go to the legislature and ask them for $100 million more, because it's already there. Now, the question is, what does that number look like for fiscal year 25? Does it get worse? And then, and we won't know that until, we get into FY 25. That's why we're kind of raising this issue now. We think we may be able to fix fiscal year 24 with the current money that's in there. But when we start talking about what they're doing now in the budget process, they're talking about next year's budget. So it's trying to figure out what next year's budget ask is going to be and just set the expectation of, hey, this could be a couple hundred issue for fiscal year 25. You may want to put in some cushion here. So I think that, again, I think that's going to be by far the biggest issue out there that we talk about with the budget. So and we've got a number of other budget requests. I mean, there's, we've got a number of workforce issues. We've actually had a couple of groups that have testified in front of the House and the Senate already. And we've talked to them about workforce challenges that are going on, administrative burden. We've talked to them about CCBHCs, what's going on there as far as data, outcomes, things of that nature. We've talked to them about this rate issue. So we are bringing this to their attention. It's a matter of, are we able to get them to buy into that, to move on some of these issues, especially given kind of the limited budget that they have this year compared to what they've had in the past couple of years. So hopefully we're able to be successful on that front. Again, we're going to continue to work with the department so they kind of wrap their minds around the Medicaid rate issue in general. But, also on the budget, we have, like I said, workforce, continue to advocate for any kind of workforce incentives. There's multiple other things in there, coordinating money that goes to the K-12 system, doing some kind of collaboration or coordination with that. And then kind of quickly jumping over to the policy side of things. So as far as moving actual legislation, Lansing right now is kind of in a somewhat of a holding period right now where the legislature, they returned in January, but when they came back, in Michigan, we have 110 House members. Democrats took 100% control of state government in 2022. They actually had majority in the Michigan House, 56 Democrats, 54 Republicans. So in order to pass a bill in the Michigan House, you need one more than 50%. So you need 56 votes. They had the bare minimum number to pass an item. In November of last year, two of the Democrats in the Michigan House ran for mayoral positions. They both won, which meant the majority in the Michigan House went from 56-54 to 54-54. In order to pass the bill in the Michigan House under 54-54, you still need 55 votes. So the Michigan legislature actually adjourned last year, the soonest, the earliest they did since 1968. They adjourned on November 14th because frankly, they didn't have enough votes to get anything done. And so there was a couple other reasons why they adjourned as well, but I mean, that's kind of the main reason. Fast forward to this year, we're not going to see a lot of legislative action until those two House seats that the Democrats won, the mayoral positions, the governor called for a special election. The primary for those special election was held on January 30th. The general election is going to be April 16th, which means by the time the clerks certify those and they go through all the electoral process and procedures, those two new members probably will not get seated until the end of April, beginning of May. So that's kind of why we're not seeing a ton of bills move around, which means the window to move any meaningful legislation, at least through the Michigan House, is going to be probably most likely beginning of May until the end of June. That's also going to be the time when you'll start to see the budget process really move, where they actually vote on the individual budgets in the House and most likely the Senate. But what that means is you're going to have one legislative slot, which is going to be the May to end of June. Whatever doesn't get done then, after June, the House is going to leave. They're going to go campaign because they're up for re-election this year. Whatever doesn't get done by the end of June is essentially going to get pushed off to lame duck. So that means that's going to be after November. So then you're going to have after the election, November till the end of the calendar year, Those are the two slots that we have to actually move legislation this year. So one of the things I include in the packet were some of the bills that we're hoping to see moved this year. So we've got a couple of mental health and substance use disorder parity bills that we'd like to see moved. One of them, a Senate bill that passed the Senate last October, is over in the House Insurance Committee. That bill just simply codifies the federal mental health parity law. That's all it does nothing else. Then we have another bill out there, House Bill 4707, that actually expands on that. It expands on parity in a couple of fashions where medical necessity, it makes medical necessity based on actual mental health professional, someone who actually works in the behavioral health or substance use disorder field. It's actually based on scientific criteria in those two fields. It's not arbitrarily set by the insurance companies. And then also under in-network, out-of-network coverage, it says, if you're not able to get your coverage, your service covered in-network, if you have to go out-of-network, the insurer cannot charge you anymore out-of-network, but they do in-network. As you can imagine, the insurance companies are fighting this with everything they have. That bill is tied up on the House floor. We're hoping to see that move at some point this year. If it does, my guess is that's going to be in the second part of the calendar year after the election. I think we may see it move then. We have a telehealth package out there. Essentially, these bills, and again, the mental health parity bill and the telehealth bills most likely will not impact people served through OnPoint. It's more for commercial or employer-based insurance. But the telehealth package essentially says an insurance company, you have to reimburse telehealth at the same level that you do in-person care. So there's no discrimination there. Those bills actually passed the House before they broke back in November, were sent over to the Senate the Senate Health Policy Committee last year. Last week, the Senate Health Policy Committee brought those bills up. They passed them out of committee and they are on the Senate floor. So we actually may see some movement on that package here before they break in the summer. There's also one of the changes we're hoping to make, kind of knock on wood, this year, we're hoping to see changes to the Open Meetings Act that would allow for remote participation, remote voting. Now, this would only impact non-elected boards, so it would impact their CMH and PHPs, but would not impact boards of county commissioners, school boards, townships, you name it. Again, hopefully we're able to see some movement there. And then the last one I would mention would be, we're hoping to see changes in for social workers for their licensure. The couple of bills out there, we saw some committee action last November, hoping to, over on the House side, hoping to see those still move before they break for the summer. But the bills would essentially eliminate the social worker exam as a requirement of their licensure. What we're finding out is the longer someone is out of school as a social worker, the harder it is for them to pass the exam. And we have tons and tons, social workers are probably the dominant clinicians that we use in the public mental health system. And there are probably tons of social workers out there that bachelors that are struggling to pass the exam are not able to become fully licensed. Michigan has one of the more rigorous requirements as far as on-job training for social workers to become licensed, where it's like 4,000 hours. It's almost like 3 years worth of full-time work in order to get fully licensed. But to eliminate the exam is not something that doesn't have opposition. LARA, which is the state department that does licensing and regulatory affairs, obviously has some concerns with that because that's what they do. The agency that administers the test has some concerns because that's their business, administering tests. But they have done this in other states, Illinois being the closest in geography to us. When they did this in Illinois, they went from like 400 available one year to over 2,000 the next year.
Wow.
So, I think it's something when we talk about workforce challenges here, that would be a huge benefit where we need to do whatever we can to, increase the workforce and people available. So we're hoping to see that move, at some point this year. So, I guess the only other two things I'll point out, I did include in the packet, a couple of infographics that we're giving legislators. One of them was on the Medicaid redetermination process, the rate issue that I talked about. And then the other one is on our CCBHCs. And this is off of our demonstration sites from year one. So OnPoint is now a CCBHC, so we'll update this year after year. But again, I think this kind of data, outcomes, results, I think help tell the story of why the heck are we investing as a state
Sure.
$550 million from this program? What are we getting for this? Now, this is based off of the 13 original demonstration sites. Now, last year we added 17. The proposal for this year is to add up to 10 or 13 more. So we expect these numbers to continue to expand. But again, I think, this helps kind of tell the story, helps, prove the point of permanency. Again, this is a no wrong door approach to providing services, kind of opens the door up to everybody. But with that, happy to take questions, comments that the board may have.
Is there any questions for Mr. Bolter at this time?
Sorry, that's a lot of rambling, but lots of stuff going on.
Alice?
Well, I just wanted to, I call it the Shirky bills, and I heard they got reintroduced, and I just wonder, how much do I have to worry about that?
The
Yeah, I
what
mean,
bills?
Shirky.
So last legislative session, there were two bills out there that were introduced. So Senator Shirkey was the Senate Majority Leader last time. He introduced two bills that would essentially, privatize. They would take all of the Medicaid money and all of the managed care functions that go to our PHPs and give it to the private insurance companies. So those bills were defeated last lame duck. They were introduced by Representative Kurt Vanderwall, who's from a little bit north of us over in Ludington area. I don't have the numbers off the top of my head, but essentially, he reintroduced the bills. They're in the House Health Policy Committee, but I do not anticipate those moving at all this year. I mean, there's no intention, given the current makeup of the Michigan legislature, there's no plans to move those at this point. And I guess further proof of that would be, we're still going through the Medicaid health plan contract bid that's out there now. If there was a desire to move in that direction, the department could have very well put in that new Medicaid health plan contract that they're rebidding. They could have just put it right in there and said, we want to give all this money, all the control over to these insurance companies in this RFP, and they did not do that. So I think, we're okay for the time being, but this is not an issue that's going to go away. It's going to continue to remain out there. It's still one of the top agenda items for the Michigan Association of Health Plans, who have a tremendous amount of influence and power in Lansing. And who knows? We, could very well have a change in control of the Michigan House. And then, who knows what happens from there. So, never say never, but I think in the short term, we're okay. But the issue is certainly not going away.
Is there any further questions, Alice? Is there any other needs? Mr. Whitney?
Alan, I wonder if you might just bring a little bit more locally for us. We have 9 legislators here in Allecon. Only 5 commissioners, but 9 legislators. And I'm just kind of curious what you might suggest, if there's any unified messaging that would be helpful for us with our local legislators in terms of the aims of the association.
Yeah, that's such a tough question too, because you have 9, so I think you have like 5 on the House side, so none of them have Allegan County
6.
as frankly their home base.
Right.
All their home base is probably from another neighboring county, so that makes it tough from a messaging standpoint of what to do. You know, I mean, I'm gonna be working with, LRE staff here coming up over the next several weeks, meeting with a lot of the West Michigan legislators.
Yeah.
On behalf of the LRE and some of the needs there. So, I mean, I think, funding standpoint, the funding formula, I mean, I think has been, inherently a disadvantage for this region for whatever reason, the state decided to set that up. It's been a disadvantage for West Michigan since it started. I mean, that could be something that's not necessarily an association talking point, but from someone that lives is from West Michigan. But I mean, I think, I guess, the overall, it doesn't matter if you're from Allegan County or you're from Marquette or wherever, workforce is a huge issue. So, I mean, whatever, if you've been able to take advantage of any of the, scholarship reimbursement, tuition reimbursement, anything on workforce that would help you all, I think would be, a good message for them to hear. Also, I think, again, another universal message would be any of the administrative burden requirements, things of that nature, I think are particularly of interest. And given the makeup of your legislators, I think is probably the easiest one to sell to them of just their inherent distrust of the department and of the administration of, boy, look at what these people make us go through. I think that's probably, probably the easiest one. And, one of the examples I use all the time is the CLS, where we went from, for a direct care worker having to do one report a day to one every 15 minutes, which equals out to 96 reports a day. Where, in an 8-hour shift, they're spending 3 hours doing paperwork versus providing care. I mean, that makes zero sense. And the department is not very sympathetic on that whatsoever. I mean, I think that's something that's an easy thing for them to get of, okay, how do we fix it? And I think, what we asked them to do is to put pressure on the administration to move in a direction to lessen some of that burden. So I mean, I think those are some, probably the workforce and the administrative burden that make are what I would press on.
Sure, one more quick one if I could. Just you know that Senator Stabenow at the federal level is retiring this year. And she, of course, has been credited as being kind of the energy behind most of the CCBHC advancement. Do you think as a system, we have anything to worry about with losing her in terms of the momentum of that innovation?
No, because I mean, I do think they were able to get, I think in the last bill, that CCBHC, the demonstration is going to continue to expand 10 states every 2 years. So I think this year, there's gonna be another 10 states that are gonna come on board. So I think that expansion is already built in. Now, she is actually working on another bill with Senator John Cronin from Texas to further enshrine, whatever, put into permanency the funding for CCBHC. So it's no longer demonstration funding, but the funding is actually permanent in the federal budget moving forward. And then a number of other protections in there. So I think she is still working on that. It's probably a long shot that they get that done yet this year, just given Congress is meeting less frequently than our legislature is meeting. But I mean, I do think there's probably enough momentum out there now where it's going to be hard for them to turn that ship around. And I think that's from a state perspective too. I mean, if we get to, if they again expanded another 10 sites, I mean, we're talking almost 40 sites, $550 million. How in the world are they ever going to walk away from, well, the federal funding went away, so we're done with this program. You're really going to say we're going to cut $550 million in mental health funding to people across the state? I just, politically, and from a political standpoint and a policy standpoint, that's awfully hard. And it's almost getting to be too big to fail at this point.
Thanks.
Is there any other questions from the board? Seeing none, thank you very much for coming and visiting with us and giving your report, Alan. Appreciate the work that you do for the CCA, the association, and keep up that good work.
Happy to do it, and you all know how to get a hold of me. So, and I included in the slides, my contact info, and then any complaints you can send to the other guys. Thank you.
See you in 4 years.
Yeah.
Well, thank you. Next on the agenda is the program committee report. Ms. Kelsey, I'll give you a minute here.
Had it right here, my notes. I'm doing it. Okay, we had a presentation from, the Access in Crisis, group. And, their big information that I've heard is two things. We've been asking all of the departments to give us an idea of what's changed now that we're with CCBHC. And, they were telling us the numbers are, somewhere around, we used to have, say, 300 new people a year, and now it's over 1,000. And so that's significant, certainly. But one of the things that they are most interested in and kind of actually excited about is that they are going to be implementing a new policy as far as intake and access. So that they're going to be offering what they are calling same day or a walk-in access. So that right now you call, get an appointment to have an access evaluation. And then there's yet another period of time before you can actually start receiving services. And what now they're trying to do is to have it be where you can just walk in and have that assessment that day. And then it'll shrink that amount of time to wait for actually to be able to receive services. And I thought that it's a really awesome, I'm really hopeful that that will be a change that they'll be able to do. Certainly, you never know how many, whenever you have a walk-in situation, you never know how many people are gonna walk in the door. And so you don't know how to staff it, but I think that they'll work that out. And that they did show us that they have we now are going towards a new software program for our electronic medical records. And they have a little contest, and it's now going to be called Crane. And that actually kind of goes with the some of our logo. It's sort of a take on that. And so instead of having to say PCE process, it's now just going to be called Crane, which I think is going to be a nice way. And one other thing I was just gonna mention is that Mandy made a comment that there is a new requirement for the provider network to some new kind of reporting that needs to be done. And I did ask, and there is already in process to try and make sure that the new reporting is meshed with Crane. And so it won't be two separate software programs out there that people will have to learn and try to enter data into it. I think that was it. I'll find my notes when I finish talking, but that was the main thing. Did I forget anything? Yes. Okay.
Is there any questions for Alice? Hearing none, thank you very much for your report this evening. Next on the agenda is the Finance Committee report.
Okay,
Ms. Johnson.
thank you. Over on page 5, there is a correction that I'd like to point out quickly. Second paragraph, almost to the very end, there's a dollar amount of over $4 million. Scratch that off. It's just over $2 million. So that was just a wrong number. For this this month or for the month of January that's being reported, we're very strong, going well. The number of units that were served, covered the CCEHC revenue and expenses stuff this month. And we're having, or the leadership is having a meeting at the last one of the building for the fiber connection, the generator, and we applied for a grant, federal grant that might help with paving the parking lot and so forth. So that's the financial report. On page 7, we have, one motion, we have to pay the bills again, or action item, I should say. I move that the OnPoint board approve the February 2024 disbursements totaling $3,181,650.78.
Do I have support for that motion?
Support.
Support by Dr. Clay. Is there any other further discussion? Being that we are spending money, this will be a roll call vote. Pastor Craig Medby,
Yes.
Dr. Clay,
Yes.
Alice Kelsey, Beth Johnson,
Yes.
Jane Farrell,
Yes.
I say yes. Jessica Castanon,
Yes.
Ben Brookhouse,
Yes.
Pam Brenner,
Yes.
and Kimberly. That motion carries. Continue on.
That is all.
Thank you very much for the financial report. Next on the agenda is the Recipient Rights Advisory Committee. Chairman Brookhouse, would you like to give us a?
Thank you. We did meet and our numbers are on page 17 if you're interested in looking at those. So we are on a quarterly basis now, which is working out well. We are able to conduct the business timely. Right now, our numbers of allegations are trending down towards an average of what we've had, which is good. And also the timeline of reporting is trending 60-day area versus the 90 days, which means we are completing the reports on time. We reviewed our report, our goals. Kelsey reviewed the goals of the team, and we did have 2 members of the public present to express some gratitude and some concerns. They were thanked for their participation. So I believe that is my report, unless there are questions.
Is there any questions from the board for Chairman Brookhouse? Hey, none. Would you like to have Kelsey address the board tonight, or give you that opportunity if you'd like?
The only additional thing I have is that we are preparing for our triennial assessment. So that is scheduled for the end of April. So we are working on submitting our first round of data for that this week. So just an FYI, that's happening.
All right. Is there any questions for Kelsey? Well, we have her here. If there's none, thank you very much, Kelsey. And yes,
I just have one clarification, please, on item 18 of our agenda. It's been pretty consistent that it states we're meeting at 3 o'clock and we actually meet at 3:30. If that could be changed for the future, appreciate it. Thank you.
Megan will note that.
That is what Mr. Chair, thank you.
Thank you very much for that report. Next on the agenda, we have with us tonight, Mary Dumas. Thank you very much for coming down and being with us tonight, Mrs. Dumas. She is our LRE president, right? Or no, executive director.
Yes, thank you for having me. Love the new building. I was there when you guys were doing all the work, so it's nice to actually see everybody moved in. So Alan stole a little bit of my thunder, and I saw a little bit of my thunder in Mark's report, so I don't want to steal his, so I'll bounce around a little bit. So I think probably the things that probably stand out for you guys are revenue. And one of the things we're most concerned about always in Region 3 is, do we have enough revenue to serve the people that need to be served? So the board had tasked me this year with trying to increase the revenue at the LRE, which is kind of a bit of a conundrum because I don't have pop bottle drives and bake sales. So I had to come up with a way to increase our revenue. So one of the ways that we looked at is we needed more have waiver slots, and there's a history behind the habilitation waiver slots, and that they were allocated based on a very old methodology from when the state institutes closed many years ago.
Wow.
A long time ago. So it's not really a good method to continue to be utilizing. We have 2 PIHPs in the state of Michigan that have been on a corrective action plan for 5 years because they cannot use the slots that they've been given. And Region 3 needs more. So the state promised they would have a new model for us by October 1 of 24, which came and went. So now they're saying they're going to have a process redesigned for the reallocation by October of 2025. However, in the meantime, Region 5 gave us 30 slots for our region, which is about $2.2 million. Not a ton of money, but it adds up over time. So we have been filling those slots at 10 slots for 3 months is how the state requested we do that. So this month we sent in 10 packets, next month 10, and then we'll wrap it up in May. Another PIHP has offered us 30 slots. However, the state has kind of put a hold on that as they're afraid that we'll get too many, and then when they reallocate them, we could lose them. I'm going to continue to beat the drum about that because I don't think we're going to lose those slots. I think they'll see that we're definitely entitled to them. So that's one of the things we're working on at the LRE, which means we're working with all the CMHs in the region. And this month, because we have 10 new slots that we previously didn't have, we also had 6 slots open from people that had passed away or fallen off the waiver. So we filled 16 packets, and some of those were from OnPoint as well. So each time we send them in, each CMH on how many new slots they've been given. The slots are slated for the entire region. They're not so many at each CMH. It's divided up as the highest need individual gets on the waiver the first. The other area that we know that we are struggling with is our rates, and our rates are determined based on some risk factors, some geographical factors. And so our region has either fared really well when they rebase us, or we do really poorly. So we either move way up to get the best rate, or we're at the bottom when we take the greatest cut. And it's really hard to manage when you have that kind of volatility. So trying to smooth that out. So when the new rates came out at the end of 23 for 24, or at the end of 22 for 23 and 24, we were going to get a 5% reduction. So they split that over 2 years, so 2.5% each year. Milliman told us then it was because our amount of contacts were down compared to other PIHPs across the state, as well as what is called VH-TEDs. And it's about demographics of the population we're serving in and out of care and some data that we collect on them. So we began looking at that. We just created a dashboard. We found a few errors in the process. We've corrected them, and we're using that dashboard to help drive for the CMHs so we can get our level up so that when we get rebased, it will increase the actual rate we receive. We have one of our CMHs in the region last year had about $8 million of encounters that were not being counted towards our rates, which is substantial. That doesn't mean $8 million is out of our pocket, but it means that it lowers our overall rate on every single individual that we're serving. So we're looking at how do we help them get to a point that the neediest individuals, the top 100, have theirs in, and make sure that we can drive our rates up. I think in Mark's report, it talks about our contract that we're working with the CMHs. So as of last Thursday, we met. The contract's been through a lot of iterations where it's a pretty tedious task. So at this point, we had a goal set of April 1 for the contract out between the PIHP and CMHs. We have abandoned that. We have moved it to October 1. We're gonna extend the contract we presently have. And we're going to work through every single concern we have in the contract. Much of the challenges we're running into isn't really something that's up for discussion per se, as far as it's contract language right from the state that comes from us down to the CMHs. But it really is around who's responsible for what, even though the language is not the issue, it's the responsibility, what's delegated, who's responsible for each piece. So we're kind of circling the wagon again. We have a meeting tomorrow with the operations council, which is the CEOs of the PIHP, or with myself and the CEOs of the CMHs. And we're going to talk about, can we start with the delegation grid? Like, does this make sense? Here's an example. We mocked up a couple pages to get them started. If that makes sense, we're going to go in that direction, and then that will drive the contract to sort itself out. So we think we need more time. It's not something we want to force through. It just creates a lot of stress on everybody, and that's not the goal. The goal is to have a contract. As you guys know, Stephanie Vanderpoint, my CEO, she says it's going to be like the Magna Carta when we finally get it out there and sign it. It's going to be that valuable. So we're holding her to that. Alan touched a little bit on legislative meetings. The only thing he didn't add to that. So Alan, myself, and Stephanie will be meeting with the legislators. We tried to pick some top heavy hitters across the region. And if there's any representatives from like the Allegan area, then Mark gets an invite to those as well. So we want to include our CMHs in that process. If they're able to join us, fabulous. And if they're not, then we'll just report the information back. And I think pretty much Alan covered the other part, is that the PHPs have been working really hard to make sure the information that the state has in their hands as we're going into April 1st about our rates is accurate. So I talked a little bit with you guys that were in the room prior to the board meeting about when Milliman set our rates, they based it on about a 70% decrease of the growth that happened in that 4 years of the pandemic. So if you took that growth and subtracted 70%, you still had about a 30% growth from pre-pandemic. But actually is what we're seeing in the numbers presently is 83% decline. So it's a difference of 13%, which is significant when it comes to rates. So all 10 PHPs participated in pulling our data together. We pulled that information together. We had 2 or 3 people from the PHP system. One of them is a previous CFO. Met with Alan and Bob yesterday and went through that, and then it will be being presented to the state. I'm feeling much more confident in this round of rate setting, in the sense of we're showing up at the table with a product to say, this is what we need to cover the revenue gap, not, hey, we need some money out here. We actually have the numbers, and we're trying to be in the driver's seat as opposed to being the passenger with the state and Milliman. So I think we're sitting in a better position this time than we have been in the past. And we also will have Wakely at the table with us, which is a outside organization that the LRE contracted with, as well as 9 PHPs joined together and contracted with them to help us in the rate setting process with Milliman. So we feel like we have an actuarially sound team behind us, as opposed to just being on the wing of Milliman. So that's what I have for an update.
Thank you very much. Is there anyone that would like to ask Mary a question about her report or any other things? Yes, Alice?
Well, it's more just of a comment. I guess I'm actually glad to hear this, because one of the things that I think about when I'm sitting on that board is, you know, we've gone from, you know, being in trouble with the state, and then them assigning us in essence, a babysitter, right? That Beacon came in and said, okay, we're gonna show you how to run this, you know, and then now that one, they've gone. And to me, this gives us some time then to really look again and see what makes sense for the LRE to do, what makes sense for each of the individual CMHs to do. And I just think that that's gonna be beneficial, because then it's gonna be the most efficient use of those small amounts of dollars that we get from the state every year. So I'm pleased to hear that.
Yeah, one of the things I didn't cover that I'll just throw out there, because I think it's just interesting information. So when 3 years ago, when I started, the LRE owed the two CMHs. Did they owe it? Did they not? I don't know. That's still up for debate, but they had put out at a community level $29.3 million. So that money has all been spent. All lawsuits have been dropped. The LRE presently, if we don't get any more revisions in, we have $30 million in our ISF, and we have $16 million in Medicaid savings. We cannot have more than 7.5%, which would be around $54 million. So we're not maxed out. But one of the challenges we're having during this very tumultuous time with rates being low, cost of services being up, is that if we don't manage the money quickly, it goes out much faster than it comes in. If we're ever gonna say that there was a blessing to the pandemic, it's because a lot of people got on Medicaid and the PHP was able to recover. I don't see a pandemic coming again in another 100 years. So we have to really manage the money that we have wisely. So we have a pretty important meeting tomorrow coming up with our operations council to help one of our larger CMHs try to stay within their budget without draining the LRE accounts. And it would be really important that some private cities are made. That's one of those tough places to be, unfortunately. So I just want to say thank you for letting me come tonight.
Very much welcome.
Thank you.
And we appreciate you being here. Mark, do you have a question?
Yeah, Mr. Chairman, it might be helpful for you to sort of ask Mary to acknowledge the fact that we have a discussion going on that we really need to have around this region, which is around the matter of how we get toward the real focus of service development for people that are in need in the region for those services. I think as we've gone through the highs and lows of cooperation with one another, as we've gone through the highs and lows of financial abilities, and now as we kind of go through maybe some of these budget and rate woes a little bit, I think we all believe that the services that you receive are no different than the services you have available to you at any other county. I'm not sure there's that sense that we're at that point of need. And so I think as we work together, I want the board to be aware that that's a live conversation that we need to have with the region and amongst ourselves about what do we need here and where is that available, at comparable levels in the region. How do we work toward that sense of equity? So I'll just mention it that way to make sure that, the board is aware that that's a conversation we are aware of the need for. We are not here to primarily draw inappropriately from others, nor to contribute inappropriately to others. But it's, you want the services that are available in this region to be evenly available and evenly distributed. So that's a, I'll just say that.
And I think that the other thing that I didn't mention, another item that we talked about, a way to bring in further revenue, but also bring in needed services to all communities is, in the past, we had an opiate health home in other regions, but not in Region 3. And
What did you say?
Opiate health home? It's not a home where you go to live. It's a behavioral health home. It's for individuals that have a diagnosis of opiate use. And they get a wraparound service. All the services wrap around them to help them in the recovery process. It started in Region 2 because the year that they looked at the data had the highest death rate for individuals due to opiates. By the time they got the model up and running, Region 2 was no longer at the top, but it was all right, it was up and running. So one of the things that we have been concerned about and continue to watch is that we have Kenton County and Muskegon County, who are very large metropolitan areas. They have Muskegon as one of the highest death rates due to opiates in the state, but our region as a whole didn't rise to that level. So they looked at it regionally. So one of the things that also came out in the process is we were never really eligible for the OHH or BHH because of the way we do our contracting. The PHP does not contract with our SUD providers or substance use disorder providers. We run that through our CMHs, which is put us legs ahead when it comes to the CCBHC. So it was kind of in direct conflict. If you were looking good for CCBHC, you really weren't looking so good under OHH, BHH in that area. So we keep I've continually, since I've been here, talked to the state finally, the state is willing to rewrite the handbook around that and request some waiver, language to the feds. So they are ready to move forward with us for 2025 regarding OHH and VHH, which the majority of those people are being served in our communities already. It will give us additional funding on top of that to have more of a collaborative wraparound service for them. So it's really about coordination of care benefit. And if you are a CCBHC, you are a behavioral health home already. So you're already meeting the criteria. So at first I thought, is that double dipping? And they're like, no, there's certain specific things that we can use it for, which would just bring more revenues into what you're already doing. So that goes along that same thing that I think is going to be really important as a region, that maybe we don't do it all at once, just like CCBHC, 2 out of the 5 did it. Now the rest are doing it. We roll out the OHH, VHH, and then we continue to move CMHs in their system towards that.
Based on the conversation I've had with board members, and so I think part of our heartache around access for certain nurses in our community really involved what was lost through day programs for people with either developmental or intellectual disabilities or people with serious mental illnesses who were unemployed. So that's an area of build back that we would like to see.
Right, and I think as your CCBHC is successful, that's revenue that you maintain
Right.
in your community and you can use as you
Right.
choose.
Thank you.
Mrs. Johnson.
I'm wondering if there's any conversation with the COOs or for this agreement that the ISF is funded individually by CMHs. Whereas you might hold the fund, but if we put in 5 million, we can only take 5 million back out.
Yeah, it's not set up that.
But could it be?
Yes, it could be. I mean, essentially, if we would have to change the bylaws. I mean, there's a lot behind that, but, absolutely, I think you can set it up that way. I would
You
have,
hear that, Mr. PR?
I would say I would want to get legal on that, but,
Sure.
I think if it's written in your bylaws, then,
Right, well,
then you're able to move on that. So I just want to, so you guys remember the war over the bylaws? I don't know if you guys are all familiar with that. We did change the bylaws a few years ago. So everybody has equal representation at the table because that's what partnership to me means. So, sometimes you might win the battle, but do you lose the war? I don't know. I might have lost the war on that one. But is what I will say with that is I do think in order to be equal partners, you do have to have equal vote at the table. And part of the process when that moved forward was, you'll remember, the previous bylaws said it could pass with a 4/5 majority. The new bylaws say it has to be all 5 members have to agree to a change. So that would be the challenge, is if you could get all 5 members to vote to change the bylaws.
Well, then I guess my next question is how do you hold, repeat offenders accountable for fiscal irresponsibility?
So I think that's a very valid point. So I think that's one of the questions of why the conversation that we're going to be having like tomorrow is important. And it's not just important, it's essential.
Oh, yeah.
Because the reality is I don't have a stick.
No.
And so the largest thing I have is I have 4 other CMH directors that will be negatively impacted if I have an offender that continues to take the money. And under the old model, they could do that because let's be real, Allegheny could partner with West Michigan and they really didn't even have any veto power at that point. Right, based on the number of votes. And that's exactly why I said the water's gonna get rougher before it gets better. It is. Change is hard for people. And when you are the shark in the pond and you're used to eating all the fish in the pond, now I took you out of the pond and put you in an ocean and made you all the same. So it absolutely, it's gonna get worse before it gets better. Hopefully we can move through that professionally, collectively, continuing to hold each other accountable. My biggest asset at the table is the other CMH directors. They're the ones that hold that hold them accountable, because the way it is written, if you want to spend more than your PMPM, your per member per month, you have to other CMHs to be willing to be under budget and to agree to give you their money.
Do
Otherwise,
we ever, Mark, do we ever agree to give one?
Mark never agrees to that.
Good.
I mean, I can tell you, I mean,
Well, good in the sense that I feel like we've been putting money hand over fist into the ISF for the last 4 or 5 years. And we have slashed, as Mark says, the services and so forth. And we've done our due diligence and we see our partners not even being held accountable. It's getting,
I think, Beth, we're right at the point where that is starting to change. And, I mean, Alice, you've been at the table a lot of times. Pastor Finbeek, you're joining that group now. The group in the past, I don't think was questioning a lot of things. I think they're starting to question now, which is good, which leads to rich conversations. I think we will get there. I think there is a lot of misunderstanding about risk bearing, the whole term risk bearing, and the understanding that the PIHP is the risk bearing entity. We are to a certain extent. But if the CMHs are not risk bearing in some way, a PMPM model will never work. So when you are under a capitated system, you have to stay within your PMPM or it does not work. And Mark has done an amazing job in this county of coming in a situation that was very upside down, to not just righting the ship, but still being able to move forward in the direction with some vision and values of where you guys want to go. And that goes to really tight management. I think that the other CMHs can get there. The hard part, I think, is it's not just one CMH. One year it's one CMH, the next year it's a different CMH. So it's kind of all over the place. And sometimes we have not been able to sort out why it has happened. We've had some turnover in the region as far as with some director level positions. We've had some change in EHRs, which I think is moving that in the right direction. It's helping us sort through that. I do think the next 24 months are critical. They are critical because as the revenue is going down, here's the other part about the ISF that makes no sense to me. The state set a cap of 7.5% of your revenues. Well, as your revenue is going down and you're taking a hit, so is what you're allowed to keep in your ISF, which makes 0 sense to me. When you're going downward, you need to have more money available, but that's not how they have set it up. So I do think the next 24 months is going to be really critical. And I think that continuing to stay the course and be methodical about what is the expectation, what does the bylaws say, what does the operating say, the operating agreement, and continue to hold people accountable and ask the tough questions. Is going to set the expectation that people have to stay in line.
I have one more question.
Yes.
Other than the relationships to rely on of the executive directors of CMHs, because that's all relationship based, what's in writing legally that holds CMHs accountable?
And the operating agreement. And one of the challenges we're having right now is for the 5 individuals sign the operating agreement. Our 5th partner did not sign it because they're not in agreement, but they have said that they are going to abide by it. We actually had a call with legal about that. I actually had a call with my board chair this past week about this matter. I've been told by the CEO of that board that they will not sign the agreement if it refers to the operating agreement. So we're trying to do, like, take the language out of the operating agreement and put that into the contract. My concern is if they continue to push me in that direction and they say they're not gonna sign a contract as a PIHP, then that means you're not willing to provide services under the Medicaid contract, that I'm going to need to then notify the state and put out an RFP. That is not the direction I want to go. I don't think it'll get there. I think that there will be resolution before that,
I hope so.
as well as I do.
Yes. Well, keep working on it.
So it's kind of like we're all in this together. We all need to play in the sandbox, and I think that's really important, that everybody plays in the sandbox and is open, and it's not just about one county or one CMH. We are a region, and it's hard. Only government could have set up the craziness of the PHP that we have in the state of Michigan.
Are there any further questions? Okay. Is there any other questions from any other board members?
Again, thank you for having me.
Thank you very much for coming here and fielding our questions and giving a report. We appreciate your presence here and thank you very much. Okay. The next is my report. I have not received any changes to the bylaws or the policies for approval. Megan, have you? So the one question is to go ahead and take care of that piece of business as to approving the board policies and bylaws. Do I hear a motion to approve them as submitted?
So move.
Glenn, you support it? Motion by Robin. Supported by Glenn for the bylaw approval. I will take a roll call on this. Kimberly Bartnick,
Yes.
Pam Brenner,
Yes.
Glenn Brookhouse,
Yes.
Jessica Castaneda,
Yes.
Gail Dugan says yes. Jane Farrell,
Yes.
Beth Johnson,
Yes.
Kelsey, Alice Kelsey,
Yes.
Dr. Robin Clay,
Yes, yes.
and Pastor Craig Mendy.
Yes.
Those stand approved, and I will sign the original copies as I'm supposed to by being chair. And then the next on the agenda is a report on our Friday's meeting. We had a review of the compliance update. Mandy gave us a very good summary of that. And we had our attorney here as corporate counsel. We also had the further input on the director's evaluation, which we will be dealing with a resolution tonight before I let you go on to the next item on the agenda. We also had the board reference packs. These are the multicolored packages right here in front of me. There are board resources in these packets that will be on the table. So if you want to look up something or it'll have the acronyms in it as to the abbreviations for each meeting. It'll have the board bylaws in it for policies. Any other information that's not contained in there, you won't, all you'll have to do is either talk to Mark or Megan. But these are for ready resource to have where it is, right here. And you'll be able to look at it. And so, and Robin has the blue one. So, but those are going to be available, and also historical information there as to our terms of office here. The other thing that I wanted to mention here is in part of my report is going forward. We had a discussion of administrator and chairman succession, what with full understanding as of the executive board as to if something were to happen, what happens and how the bylaws affect that. We also, I brought forward the transportation deficit that the act is going to sponsor sections on. Those are the ability to get rides to where a person needs to get to for doctor's appointments or shopping or coming here to OnPoint. And that is, was located in the Allegan County News, the March 14th edition. They had a whole article on that and phone numbers to be able to get that transportation or even put the app on your phone if you have a phone. We also looked at the evaluation results and had discussion on merit pay for our executive director for the excellent job that he has been doing and managing, getting this building done and our move here. I have a resolution at this time to pass around. I believe there's 4 copies that way. There's 5. And this is the resolution that way for that side. And everyone has it. I will read the resolution and ask for support of it. A motion and a support. The resolution that is being offered by the executive board is whereas the OnPoint Executive Director, Mark Whitty, has been serving the agency as interim or permanent Executive Director since 2017. And whereas the OnPoint Board of Directors Executive Committee has conducted its annual performance review of Mr. Whitty's employment on February 2024, pursuant to Section 9 of the Executive Director's Agreement for 2022 to 2025, the contract. And whereas Section 9D of the contract provides that Mr. Whitty may be provided a merit increase to his salary at the discretion of the OnPoint Board of Directors. And whereas the Executive Committee recommends that Mr. Whitty be provided a merit increase of $375 per pay period from April 1st, 2024 to March 31st of 2025. Be it resolved that the OnPoint Board of Directors authorizes a one-time merit increase of $375 per pay period from April 1st to 2024 to March 31st of 2024 to Mr. Whitty to be paid out following the completion of the annual performance review.
It needs to be 5.
5, I'm sorry, it's make that correction in the official one.
Okay.
With that said, is there any discussion on why or the how or the process that we came to, the executive committee came to recommend this merit increase?
Amen.
Amen. Well, thank you, Robin. The biggest thing was the amount of work and the extra work that he has done going forward. And we see that as that is going to be accelerated through the different programs and things that we're instituting with the new programs that are coming down and that we're getting the CCBHC up and running and facilitating that process and dealing with our legislative complement that we have now as to things that are coming through from state and feds, but also looking forward, seeing that this is going to be based on his future performance. We would like to keep that standard as high as possible. So that is why, and we have, had legal, look at this. This is the appropriate way of honoring that through a merit increase. And that's, what we are recommending to the board. Is there any questions?
As stated, with the correction of 2025.
Support. Okay. Support by Glenn. Since this is a monetary, question, I will take a roll call vote. Jane Farrell?
Here, yes.
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 Here.
Beth Johnson?
Yes.
Alice Kelsey?
Yes.
Robin Clay?
Yes.
Pastor Van Beek?
Yes.
Kimberly Bartnick?
Yes.
Pam Brenner?
Yes.
Glenn Brookhouse?
Yes.
Jessica Castaneda?
Yes.
And I say yes. That motion carries. You're welcome. The other, part of my duties as the, chairman report is to take care of some internal business. One of the things that, and I'll just read the note. I need to ask you to distribute this form to each board member tonight and ask them to return it to Megan. The addition of a social security number is new and has been added due to the new federal regulations that involve ownership interests. We ask for it every year at this time. We will ask for it every year at this time, and I'll add it to the annual calendar of tasks. And so these are the new things that we have to comply with to make sure that everything is going well. It will be an annual conflict of interest form, and Megan is passing those out at this time. Please fill it out and bring it back to Megan. Do not pass it through me
Or me.
or Mark. Yes. We go. And that way, that chain of custody will be handled. With that, yes,
So just so I understand this, that really the only thing that's new about this is that we have to add our social security number to it. Because we do this all the time, the conflict of interest, right?
yes.
Just want to be sure that was.
Would you like to make any comments as to, Mandy, as to compliance?
So what we had tried, so you do this every year. And so what we tried to do was to be sure that we were able to merge the language from the document that the LRE had asked us to sign, so the disclosure of ownership, and put it together into one. So that way, hopefully, we meet the requirements from the state. So it's very straightforward. Retain it, and the LRE wants it, they know where to get it, and it's just a normal part of the process. Megan will keep it, because she's your sort of keeper of the board records. And then I also retain a copy because I'm your compliance officer. And so if anybody ever wanted to audit anything, but it's all secure, it's within our systems, so on and so forth.
The other thing is the board makeup has to be a certain percentage of commissioners, which we have two, Mark Young and myself, a provider of MH services, HC occupations involving with mental health, general public official, recipient of or a primary consumer, or a family member of a recipient or primary consumer. And the code says that we are supposed to have no more than 6 public officials, a minimum of 2 recipients or primary customers, and a minimum of 2 of family members. So this will help us to make sure that we're compliant with the consistency and the parameters that the board makeup is supposed to be by the code. And It makes it very easy for us to maintain that roster that way. But, and because there's life changes and people become providers, they can move in and out of different categories. And that way we can keep track on an annual basis and make our compliance easier. So I'll go ahead, fill that out, get it back to Megan and directly, and appreciate that. With that, I don't believe that there is, well, the next thing is there any questions for me or comments on the chairman's report? Hearing none. Oh, do you want me to do the board update for the workshops?
Please.
The one thing is, next month's, workshop is going to be on participatory governance and ethical implications. And I believe I pronounced that almost correctly. Megan will send out that email tomorrow with the link to the workshop, as well as the list of individuals that will not need to complete it because you have already done it, in the past. Again, please send your completed evaluation to Megan via email or give it to her at the next board meeting. So with that, is there any other questions for me as chair? Hearing none. Next on the agenda is our OnPoint Executive Director's Report. Mr. Whitten.
I'll stay right here since it's quite brief. It's all right with you.
Yes.
Just thanks to our team. I put on the agency about for the time away. I really do thank the team. I think this is the most disengaged I've been able to be on a vacation,
Good.
thanks to the help of the team that was here minding the store. So thank you to those who have done that. I know that that's just a real rare treat. So really, really nice. I did put a note in there about the funding request. We were contacted by Debbie Stavenaw's office and invited to submit nominations for funding for things of significance. And we had a couple of them that were out there as needs. So we did submit those, and thanks to Andre and the team on the finance side for getting that done. We've been given the encouraging news that it could be this year or next in terms of when we find out the results of that request. So we'll all see. We'll cross our fingers and hope for the best. But I think the total amount we submitted was in the neighborhood of $750,000. So we'll see what we can do. On the topic of board terms, as you know, we had 4 members, Jessica, Kim, Craig, and Beth, that were all had terms that were expiring. I was notified by the county clerk that we also received an additional application from someone who's not currently on the board and have had contact with that person and provided comment back to the commission. The thing I had a conversation earlier tonight just with Kim about, well, should she plan on being here for the next meeting or not? The commission won't make its decision until a week from Thursday, correct?
Yes, the 28th.
I would encourage, just from where I sit, to encourage those who are on the fence to plan on coming. Generally, that's how it turns out. So we'll let you know soon after that's been either confirmed for another term or thanks for serving, one of the two. But anyway, just plan on coming to the next meeting. And it's great to see members of the community expressing interest in serving, including those who have reapplied. On the regional side, again, you've heard some of the benefit of the data has, continues to be so important that we supply to the state. And anything that we can do, especially now through the emergence of a new emergency medical record, that will improve the accuracy even further. Thank you tonight. So that's an important development. And then on the contract itself on region number 4, we will be indeed continuing on the current contract through the rest of this year through continuation and working for a fiscal 25 contract to be in place, as they say, the Magna Carta. With that, that's pretty much covers everything I had on my process. I want to thank Alan, who's gone for attending tonight. It had been 4 years since he was here last, and I'm really thankful you had a chance to hear from him directly. So Thank you very much, Mr. Chairman. That's all I have unless there's questions.
Is there any questions for Mr. Whitty at this time? Hearing none, we'll go on to the second provision for public comment. Is there anyone in the audience that would like to take advantage of public comment at this time? Second call. Megan, is there anyone online?
No.
Going a third time. I'm going to close the public comments, second comment session. Board member comments. We'll start over on this side. Jessica.
I'm just glad it's still light out. Thank you.
I second that.
Kimberly, anything on the comments?
Nothing right now. Yeah.
Alice?
I did have a question and an announcement. Mark, you were mentioning about, maybe applying for the, money to pay for the generator. I was just curious, has that arrived yet? I remember it being in this long thing, and are we operating without a generator?
Don't lose that vibe. You want to speak to that, Hunter?
Yes, we are, but we have an RFP, but we have an RFP that's out, and we've received, four proposals that we are going to go through in collaboration with the county.
Oh, because I thought we had already ordered one and it was just, we were waiting for it to be delivered.
No.
Oh,
As Hunter said, we put out a proposals.
yeah.
We've gotten bids. Some of the bids involve building and delivering in as many as 40 weeks. So they're out there. So it'd be much.
There are two of the vendors that applied, and we could have something forward.
Well, the other thing I just wanted to mention, I talked it over with Kim, she is recently had her be the vice chair of the program committee, and I just let her know that I'm going to be gone next month and that she is going to be chairing the program committee. We're going to have to mention that at the program committee.
Well, surprise, surprise. Kimberly, you probably do a wonderful job.
I
You
hope
had a
so.
great mentor. Jane,
I just want to say I'm grateful for this, especially us of Alan Bolter, who provided an abundance of information that was very helpful and useful.
Glenn? Good, thank you. Mr. Bendy?
A couple things. I want to thank Mary for coming, your candor tonight. I appreciate that. Just being on the LRE for a short time, I know you're working with a lot of personalities there and there's a lot on your plate. So she does fight for OnPoint. Don't misunderstand that. She does. So I want to thank you for all you do. Mark, I want to thank too the executive committee for bringing this to us. Now I'm not here every day. I don't work with you every day, but what I've seen over the last few years is you constantly want to grow. You're constantly looking to improve, and I appreciate everything you do. So I want to say thank you, and this is well deserved. Thank you.
Mrs. Johnson?
Doodle.
Anything
Think we
else?
can
No,
all
it's
say
It's 7:15. Let's wrap it up.
Well, with that, I appreciate everything that this board does and puts up with, and you always come with a sense of humor and candor. Wanted to thank Alan for coming tonight. I see how hard he works at the conferences and the reports that he gives there. And he does a wonderful job for the entire state of going and trying to get the problems and the things that legislators need to deal with on the forefront in Lansing. And Mary, I appreciate you being here. Appreciate the work that you're doing at the LRE, and keep up that persistence and equity that we've come to expect from you. Thank you very much. And as for the rest of the staff that we have here, I know daylight savings time is a rough thing to go through, but, we have survived. We got through St. Patty's Day. But thank you for all the work that you do for this organization. We are really becoming a top-notch professional organization, and people are starting to realize and see, because we're in the paper, we're on the streets, we're getting things done for the people we serve. And I want to thank you from the bottom of my heart for the effort and the emotion and the spirit that you bring to this job. With that, I'll entertain a motion to adjourn.
Move to adjourn.
Motion by, support by Kim. All in favor, say yay.
Yeah.